Hello, I'm Jeffrey Gunzenhauser, the Interim Health Officer for Los Angeles County. I'd like to provide you an update about the status of the measles outbreak that's occurring here in Los Angeles County. Many of you have heard the news of a multi-state outbreak in the United States and also Mexico, originating out of an exposure that occurred in Disneyland about a month ago. Currently in Los Angeles County, we have confirmed 15 cases of measles. That's as of today, January 28th. We are actively investigating all of those cases. The first thing we want to do is to protect everyone in Los Angeles County, and the first thing we can do to meet that is to assure that those individuals who are contagious are isolated from others so they don't spread it. The second thing that we're very actively involved is following up on any contacts to those individuals. So far, we've identified nearly 700 individuals who had contact with those 15 cases. We want to make sure they're vaccinated. It turns out that about 5% of those contacts, about 37 individuals, are not immune. So for some of them, we've provided preventive treatment so they won't develop measles. Some others are beyond the period where they actually could develop illness, so they won't spread disease. But a handful of others remain under isolation, quarantine, restriction of their activities, so they won't spread the illness to others. So in some cases, if you're a contact measles case, we may restrict you from going to work or from going to school to prevent the illness to being spread to others. Some other things I'd like to talk about is the vaccine itself. The safest way and the most effective way to prevent getting measles is to be vaccinated. There's a safe and very effective vaccine licensed in the United States today. Most children receive the first dose at age 1 and receive a second dose before entering school. Currently, about 98% of children entering kindergarten are fully vaccinated against measles. However, there is a small number of children who aren't protected, and there are quite a few adults who've not gotten 2 doses of measles as well. When we look at the cases that have occurred to date in the state of California, about 40% are occurring in individuals less than 20 years of age, but about 60% are occurring in people who are older. So it's very important for everyone to realize that if you haven't been vaccinated, there's some chance that you could come down with measles. In general, people who were born before 1957, that would be anybody who's 58 years of age or older today, had measles when you were a child. So people in that age group don't need to be vaccinated, but anybody who's 57 years of age or younger should do so. So we really would like everybody to take the time to review their immunization status. If you're not sure, check with your doctor. If you think you maybe have been exposed to a case of measles, you could talk to your physician as well. We'd recommend that if you think you might have measles, call ahead to your physician before going into their office, because they may want to take some special measures to assure that if you do have measles, you would not expose other persons. So the most important message that I want to share with you today is that there is measles present in Los Angeles County. It's a very infectious disease. Therefore, if you're not vaccinated, I recommend you get the vaccination. Thank you very much.